Zimbabwe is working on strategies to retain health workers in the wake of a massive brain drain that has affected the country's health sector.
The Minister of Health and Childcare, Dr. Douglas Mombeshwara, has indicated that the brain drain is a cause for concern. He said the government is working on ways to retain all human capital.
Those who are trained as nurses, as doctors, as radiotherapists, all those other specialists, we need to increase the training, double the numbers again by 2028 to be able to meet the demand that we see in our country. But most importantly is to say, how do we retain them? Because we've been training a lot of health specialists, but all are leaving for the so-called greener pastures. But we want to turn Zimbabwe into a greener pasture so that we train and retain, and then we also bring in other people who should be able to be recruited from other areas to come and work with us. I don't want to appear like we want to reverse the brain drain and come to us. Let those who train in Zambia remain in Zambia. Those who we train remain here. That's an ideal situation, although it's very difficult.
The ministry also added that it is working on other non-monetary incentives to stop health workers from leaving the country.
But we are also trying to look at non-monetary incentives to say if somebody has got accommodation on site, it cuts your requirement for money to rent outside, and then there's also no transport involved. Or if we have apartments somewhere outside the health institutions, we can put our health staff there and we provide transport for them to the workplace. So these are some of the incentives that we are looking at, non-monetary, which may help in terms of retaining staff. But obviously the monetary component, we still continue to negotiate. We know.
I think this will be an interesting thing to watch develop and see what kind of incentives they'll be talking about as they roll it out. It is very important that, and it's not just with the healthcare workers, across the board, we need to retain the skills that we have. It's been known for a very long time that Zimbabwe is a very good training ground for professionals. So if you want to have a professional healthcare worker, they're coming from Zimbabwe. If you want to have, even in the creative sector, your animators, your graphics, they're coming from Zimbabwe. They're going off to South Africa, they're going off to the UK, they're going off to Dubai, and they're developing those economies because they're bringing a very high level of skill to them. But also Zimbabweans are known to be very hard workers no matter where they go. But it also means that we are consistently training new people. So we never actually have the expertise. We have people we are training, people in transit, so to speak. And that leaves us with a very, very large deficit when it comes to the skills that we require to enable to actually keep our different sectors running and functioning in a good space. And one of the biggest problems that has led to this is the fact that for me to survive as whoever it is I am in my professional capacity, I need to be able to earn what allows me to stay alive. And in Zimbabwe, we are currently living from hand to mouth, and that's not sustainable.
Right. So one of the issues that you hear on the labor market is the fact that when you juxtapose it doesn't matter what profession one may find themselves in, chances are they're getting paid maybe 5-6 times less than what their counterparts in South Africa or their counterparts in the UK are getting. So I think you then look at the cost of living in this economy, and that tends to put pressure on the qualified and the professionals that we've got in the country. Hence the exodus that we have been seeing in Zimbabwe in recent years. And questions then become, to what extent will the measures that are being implemented by the health ministry assist in retaining our key labor force? I was taking a look at a report that says that now in the United States of America, they're now also looking for health workers that could potentially also come from Zimbabwe. So we hope that some measures can be put in place, and there can be some degree of of
retention.
meeting the workers halfway there and addressing the brain drain situation that we've got in Zimbabwe.
I'll tell you what we do have going for us, though. What we do have going for us is unmatched. We have a quality of life that you cannot find anywhere else. And by quality of life, I'm speaking to wellness support. If I feel I am unwell today and I need to stay home, I know my colleagues are going to be, Candice, are you okay? Candice, are you there? Candice, we didn't see you today. What's going on? Somebody is cognizant of the fact that I am absent and they know to check in on me. Now, life is such, it's so isolated that if you are missing a day from work, likely the only person that's going to look for you is your boss if you've not communicated that I'm not feeling well. That's number one. What that does is it also means that when you're feeling low, you're alone. When you're feeling strange, you're alone. When you're feeling like you just need someone to talk to, you're having to pick up a phone and talk to a stranger. You don't have that familiar network of family and friends within walking distance, within driving distance, within calling distance that you can then use to pick you up and make sure that you're not falling into some form of a depression. So a lot of our healthcare workers or those who are going NEMA COS, for example, have then struggled with readjustment because they find themselves in areas that they're isolated. So it doesn't matter where you go, the nearest person to you is probably 30 minutes, an hour away. And that's if you know that person. So you're not really going to pick up the phone very quickly and say, oh, I'm struggling to adjust to ABC. So you have to go through all these transitions, all these changes by yourself, which has a heavy, heavy emotional strain. When you are here, we have that balance all around. Society believes in taking care of each other to a certain extent. Yes, tinenzara sometimes, yes, we don't have enough money in our pockets, but we have a society that is actually looking out for each other. And I don't think that can ever be replaced by anything else, no matter where you go. Money is great, but at some point you're going to need human beings to fall back on.
Speaking of which, an author got a hold of me yesterday and they said, look, I wrote a book about how to navigate the diaspora. So I'm still in conversation with them. Hopefully we can get into the teensy-weенsies of their text.
That would be interesting. That would be very interesting. Because I think a lot of people are going there very unaware of what it is they're expecting. They think, no, I'm just moving. But no, the dynamic is completely different. It's completely... And here you can afford to say, okay, I'm just going to take a quick lunch break and see.
Konapo, Ipapo pa ZTN Prime, DSTV channel 294, the place to be.